everyone, it's Dr. DeCubellis from Main Street Chiropractic. Today I am joined with Mike Ricchio, the owner of MAR Health and Performance.
Hi, everybody.
Thank you for joining me today.
Absolutely.
So I wanted to bring Mike in because he is not only very close to me, but the way he does things at MAR is a little bit different than your typical training. So I wanted to ask him some questions about that and see why what he does can really be more beneficial than your typical personal training. So first, tell us a little bit about how you got involved in this realm.
Yeah, you know, I've been a private trainer and strength coach since I was 19 years old. So it's been almost 17 years now. And maybe 4 years ago, I had a very close friend bring up the idea of maybe doing something together. And that's where the idea really first started. And then my father passed away. So MAR is actually short for Mario. So the gym actually became a tribute to his name. So that's where the motivation came from. And then I did a lot of searching. I looked over 33 locations, everywhere from the city to Crystal Lake to Downers Grove and beyond. And Downers was just where I found home. I love Downers.
Nice. That's
Yeah.
a great story.
Yeah.
So tell us a little bit about kind of what your philosophy is when it comes to training and working with people.
You know, I took a lot of time to look at where the industry was going. And you look at the bigger group fitness companies, and there's so many of them now. And what they do really well is they create a community. They create an atmosphere that people want to be a part of. I recently had a new member walk out, and she called me the Cheers of gyms, which I said was the ultimate compliment. Hopefully everyone knows who Cheers is. Yeah, I know you do. So what I wanted to do was I wanted to take the quality of one-on-one training, which is what I've been working in for almost 2 decades now. But I wanted to bring a better atmosphere to that. And that's where I I shouldn't say that. That's where I really want to be involved with the small group side of training, where it was a little more intimate of a feel, but not so big that you couldn't still individualize. You couldn't still make people feel special, yet still walk in and see the same people every day and want to come in and get energized by the atmosphere of the group.
That makes sense.
Yeah.
Now let me ask you, let's break that down a little bit. So when we talk about small groups, how do you decide who's in the group, or makeup does it go by, where they're at, what their goals are? Describe that a little bit.
You know, it's a great question, and the truth is I did tinker around with doing maybe more advanced versus beginner group. The truth is we don't have to. We keep our groups to 6 people or less. And the way we program is we program based on natural human movement patterns. And then within that, there's body splits. You know, we push, we pull, we hinge, we squat, we do everything that a human body should do. But when everyone walks into a template that's based on natural human movement, it's so easily regress to progress based on anybody. Whether it's my more elderly client who has a long orthopedic history, you know, who has been seeing someone like you, thankfully, for years, or my mid-30s freshly new parent, you know, who's just lack of sleep but physically very capable and able. Either way, the regressions and progressions are very easy to put in.
Okay, that makes sense. Now, and that makes sense just because that's also kind of how I do treatment here. Is it's all based off movement patterns and things. So I'm right at home with that line of thinking.
Yeah.
Now let's talk about when it actually comes to the training, working out. Tell us a little bit about some of the things that you use and why you use those things, like whether we're talking about free weights or balls, or what do you use and why?
Well, the first thing people notice when they walk into our facility is there is not a machine of any kind. So, and by a machine, I mean nothing that has a fixed pattern to it. And not that those can't have their place. You know, I believe in a lot of forms of fitness, a lot of ways to get results. But in our facility, everything is free moving. So dumbbells, kettlebells, some barbell, but even that is pretty limited. But it's mostly bands, dumbbells, barbells, and body weight. Suspension straps, a lot of suspension straps, and a lot on the ground. We do a lot that involves crawling and getting up off the ground and moving, and cables. So everything that can be manipulated in a positive way to fit whatever human body is using the tool.
Okay, that makes sense. Now, with those, have you found? Let's talk about the kettlebells, because that's something I feel like really all of a sudden the last couple of years started getting a lot.
Yes.
What do you feel about the kettlebells, and why are they maybe superior in some aspects to other things?
Yeah, it's a good point. They've really exploded in popularity. The original thought on kettlebells is they become an extension of the arm. So from a physics standpoint, they work really well once you learn how to hold them properly, and they are great for explosive work, where a dumbbell is a little more clunky and awkward for that specific type of work. So when it comes to a power aspect, the kettlebell is just very efficient to use. it's also smaller and easier to use versus setting up a barbell and putting weights on there. So from an efficiency standpoint, once you have the weights you need, it's just so much easier to use. And in a lot of ways, they can be supplements that you can replace what you do with a dumbbell with a kettlebell. You can't necessarily replace a kettlebell with a dumbbell.
Right.
So I can get less tools in one space and give myself more options for more exercises at the same time.
That makes sense. And when we kind of talk about what you were talking about with the movement patterns and things, all these things offer that free movement. They're not locked into a specific kind of trend or track or anything like that, which is also why using those, while they can give you maximum benefit and more potential, it also means that that's why you should also be working with someone who knows what they're doing, because you have that inherent, if you can't physically move in a certain way, but you try to force it through a kettlebell because you don't know what you're doing, you do have that injury risk. So that's why it's so important to have someone there with you who knows what they're doing and can walk you through that process.
100%. And how to manipulate the tool that you have. And not just by weight. I think everyone thinks we either increase or decrease in weight all the time. Sometimes it's just positioning. Sometimes it's tempo. Sometimes it's giving yourself a better base. So there's so many ways, to your point, that we can change things. And that's also, again, to the point of why we don't need to cater our groups to be one specific type of person. Because of all the ways you can manipulate and change in a positive way, we can make those changes for anybody.
Right. Well, and that's a great point, because what a lot of times when people think about working out, it's all about going up in weight. But if you really look at biomechanics and physics, taking a 10-pound kettlebell directly with your body versus 3 inches out totally changes the workout, the muscle groups,
yes.
But it also changes the difficulty level. So you don't
yes.
necessarily need more weight. Maybe you need to change the movement you're doing.
100%. Yes. Yeah. And the way and the pace that you do it at. But you're right. Something can be at my side versus holding it up in my shoulder. And it's on the same side of my body, but it completely changes not only the exercise and the mechanics, but also how we breathe into that exercise, which again changes how we stabilize things, which can be used both to make things more difficult or easier in some ways too.
Well, and on that same tone, I think a lot of times, which I'm sure makes you cringe a lot when you watch videos of people working out, they try to get just the maximum weight, and their movement, posture, everything is terrible.
Right.
They're asking for an injury.
Yes.
And they're just asking for an issue. And it's funny because I'll have patients that come in and they say, oh, I was working out, and then something didn't feel right. And then I have them kind of recreate what they were doing, and there's no symmetry whatsoever. Their arms are different one side of the other because they're trying to use the most powerful part of their body to get the position that they want, but it's totally wrong, and they're reinforcing a bad biomechanical movement pattern, which
yes.
means they're going to have breakdown. And then when they come to see you, now you've got to retrain everything because they're going into a bad compensatory movement pattern.
Yes, yes, and it happens with load. It also happens with impact, like running. And I think it's admirable that people want to work harder. Mm-hmm. I don't want to take away from that. Sometimes that can be a better problem, quote unquote, to have versus someone that doesn't want to work at all. But the truth is, once it goes too far, you're right. Then it goes in this avenue where they need someone like you, a rehab specialist, for X amount of days. And then you bring in things like motivation to that conversation, where after you've been zapped by an injury for 3, 6, maybe even 12 months, how easy it is to get back in the gym after something like that, that's hard. It's really hard. So you're right. If people would take a step back and really take the time to get with someone that can do things right the first time, the path to success is much faster than when you try to push the issue a little bit.
So now let me ask you this, because I'm sure you probably have to deal with this. So someone comes in and they want to be trained, and they're used to doing all these free weights and big weights and bench press, and then you want them to work on bands and balls. I'm sure there's going to be a big resistance there. So how do you kind of overcome that?
By asking for a trial. It's come try it out. And typically people are awoken by how they feel when manipulated with a bodyweight exercise. And usually that's enough to just get some buy-in, get some trust of, this is, because that's what people are looking for, is to be challenged.
Yeah.
People want things to be difficult. And because load gives you that sensation so easily. If I give you a big heavy weight and just ask you to hold it under your chin, if it's heavy enough, you don't have to do anything. You're going to feel like you're working. You're going to start sweating. So if you can show other ways to get people that, then all of a sudden they loosen their opinions of, I only have to get it this one way. But the key is just getting enough to say, try it out.
Well, and two, when it comes to a lot of this stuff, if we look at what the professional athletes are doing, it is not just sitting there strictly lifting weights. It's doing all the things you're talking about.
Yeah.
Because they've got to have their reflexes. They've got to be able to be balanced in certain positions. It's not, okay, we're going to stand just still like this, and then I have all the strength to do only this one movement. They've got to be able to react. So it really is almost like a real world working out to be able to deal with life and different things you're doing at work or at home.
Yes, and so I do have a large group of pro and college athletes that come through my facility, and what's funny is they are much more repetitive in their programs than our general adults are. They don't ask for the same variability in terms of variety of different exercises, because they know in order to get better at one thing, if they're going to get better at shooting, they've got to keep shooting. If they're going to get better, if they get stronger, we've got to keep some level of repetition in. So that's another thing we try to pride ourselves in, is finding ways to bring the repetition in that's needed to see strength improvements, which will lead to fat loss improvements and metabolic improvements. But also having enough variety where people feel like they're getting that at the same time. So, but that comparison to the athlete is great, because you're right, it's really not, it shouldn't be different. It shouldn't be different. I tell people the only difference between my athlete programs and my adult programs are that the athletes end up in a competitive nature at some point. But when it comes to the training program, it really doesn't look all that different.
Right, and it makes sense, because if we're training the best of the best this specific way, there has to be something to that. So why are we not mimicking that in some instance, some way, to modify to fit the average person?
Yes. The
average person should need a totally different thing. I mean, that just makes common sense.
Yeah, not when it comes to human movement patterns, because we're all moving the same anyway. Whether someone's taking one step slowly to get to the bathroom, or they're taking fast steps to get to a rim. The mechanics are they're the same, just in different speeds, but they need to be worked at in the same way, like you said, in some nature, at a baseline level.
Yeah, and that's why I really like doing small group things like you're talking about, because each person is going to come in at a different level. You might have someone who's post-operative, or you might have someone who's just been deconditioned for years, or you might have someone who's been an athlete for for the last couple of years and is at a different state, but they could have differences in the way they're moving, and they might have different goals. So being able to evaluate that is going to be very, very key, because you can't just say, okay, here's the same routine for every single person. This is what you're going to do. I'm going to go close my eyes and grab a soda in the back room. It just doesn't work that way.
Right, absolutely right. My average population is 35 and up, which means that everyone in our facility has a history of some kind, whether it's multiple knee surgeries, or just they've been holding kids and been dealing with the same back tightness. They've been driving in a car, sitting at the same desk for 15, 20, 25 years. So everyone has a history. So I smile a little bit when people come in and they say, hey, can you handle someone like me who has a history of back stuff? And I try not to laugh, but I kind of do laugh, because it's like you're status quo here. Right. It's more unique when we have someone come in saying, I've got nothing, just put me to work. That's not our typical population. People have lived. People have played sports. People have past injuries, and everyone needs a little bit of individuality amongst the group atmosphere.
Right, and it's really, really key to what you just said too. Like, let's say someone who is at a desk and they've been on talking on the phone. They're repetitively working out one side of their body and not the other side. That couple ounces in the phone adds up over months and years and years and years.
Yes.
So now they've been conditioned a certain way. They're not even. So that's something that needs to be evaluated and broken down. They're not just coming in here as a blank slate. They do have issues.
Yes.
So that's great. And I see the same thing, too, when people come in. That's why it's always important. I always ask, what their history was and what they've been doing as a job, because a lot of times, and I'm sure you see this a lot, people don't think things have an effect when they actually do have an effect.
Yeah.
They don't think that knee surgery they had 20 years ago has an effect on their movement patterns. Yes, it does.
Yeah, if anything, that has more of an effect, right? Because they've been spending 20 years compensating from that on a new learned habit, versus someone that's fresh off it, that those compensations haven't stuck in yet. So if anything, it's more impactful, right, than less, which obviously you deal with even more than I do.
Yeah, definitely. So I love all that. And I think that it's great, too, just being able to utilize different things for different people, and it's not just stuck like, hey, here's your routine of these different machines, and everyone gets the same thing. So I love everything that you're doing over there. Yeah. We've talked about a lot of stuff, but is there anything we haven't touched on that you would like to add in?
I said it real quick, but I think just this idea of breathing and how we breathe and how it ties into everything. I think it's a really important thing that some people think is unique to us, unless they come from that yoga background, which has done a great job for how many decades and centuries of for incorporating breathing. but how much it really does affect how we stabilize and how we move. So it's something that we really put into all of our warm-ups in some capacity, and we cue that, how to breathe in certain areas, how to manipulate exercise based on your breathing, and how to change that up alone as a tool. So it's something that might be considered a little unique in terms of purely the fitness arena.
That makes sense. I like it.
Yeah.
So if you guys have any questions, I'm going to have the contact information down at the bottom for Mike. Make sure you reach out for him. He does a very unique way of working with the individual to get the needed goals that we want, and it's all based on movement patterns, so it's just very individualized. So again, thanks for coming out, Mike, owner of MAR Health and Performance right here in downtown Downers Grove.